Here's a sad statistic. 80% of tooth decay and gum disease occurs in 20% of America's children. February is set aside as National Children's Dental Health Month. February 6th was designated as Give Kids a Smile Day. All across America, 45,000 dental professionals treated nearly 500,000 at-risk children.
Give Kids a Smile Day was a day that was created by the American Dental Association 7 years ago to provide free dental care to lower income kids that really needed care that weren't getting care. And this is, it's a 7th year nationally. This is our 2nd year here in Jackson.
9 Jackson dental offices volunteered to treat 50 specially selected kids.
As a private practice hygienist and several of us that are in private practice, I think we truly had no idea what the needs of our own children and our own community was. And when we did do just a small project that would start like a Saturday clinic that was just like once a month, we were alarmed at what we saw. And as that continued throughout the year, even a bigger problem was because we knew we wanted to help children and help youth in our community. What we saw was the problem of the children getting there. Even though the services was free, there was a huge gap in our community on transportation.
Rhonda Ford received a Jefferson Award for her dental screening clinic at Jackson Central Mary High School.
My daughter always accused me of loving my son the most. And I had to explain to her, it's not that I loved him the most, he was the neediest, okay? So whoever needs you the most, and that's what I feel here. They need so much love, so much guidance. They need role models, and I'm seeing them respond in little ways. You know, things that I tell them one week, when I hear them repeat it to someone else the next week, you know, I'm getting through to them. That it's not the picture that is painted to the community. And if the community, I think, would just join in and not judge, you know, not that everyone is, but not judge these kids here, but try and lift them up, you know, just like Christ does us when we're down. And that's what they need, and that's why I just love them so much.
When the dental clinic first came to JCM, I was just a freshman. I had never been to the dental, I never knew that they had programs like this. I didn't have any insurance. My family could never afford any kind of insurance. So I'd never been to the dentist before. I never got my teeth cleaned. And I didn't know about dental hygiene at all. My teeth hurt, my gums bled just while doing simple things like brushing my teeth. I just thought it was normal because that's the way it had always been. So whenever you're uneducated, you tend to just accept things for how they are instead of trying to make it better. I never knew why I should floss, so I didn't do it. So as you can imagine, by the time I got to the dental clinic, my oral health was not on point. It was not that great. I had tartar buildup, my gums were infected, and I even had a hole in one of my teeth, and I had no idea. And being a person that smiles a lot, obviously whenever I learned this, it really alarmed me, and it really, you know, made me take a step back and think. And I also learned that I had 3 cavities. That's a lot of cavities to have. But I would have permanently lost my teeth if it wasn't for the dental clinic being here. Every day, students like me had to get up and come to school and try to stay on task every day while going through all this discomfort and pain. And we always used to have students that all they could do was put their head down on the desk because they were in so much pain. On more than one occasion, we had some students that even had to go to the hospital and to the emergency room because their conditions got so bad. A personal friend of mine that goes here, she had an infection in her mouth and it went untreated and it got so bad that it formed an abscess and the abscess ruptured and blew a hole on the outside of her cheek. You know, you could literally put your finger through it if you wanted to, and she has a big scar right here now. And believe it or not, she's not the only one. Most students have serious conditions, not only here, but in other schools, but they're too ashamed or they're too scared to say anything or try to get help or something like that. And that's why programs like this are so important.
From humble beginnings with help from local dentists, West Tennessee Healthcare, and companies like Procter & Gamble, Rhonda's clinic has grown to include x-rays and education.
Not only are we getting treatment, but we're being educated on what to do and what not to do, and we're given the supplies to do it. Now we know how to control our oral health for the rest of our lives.
Almost every student here, you could consider them an employee. They know how to pull up x-rays. They know how to define where there's bone loss on the x-rays. I'm telling you, any of them that go to dental hygiene school or dental school, they have got a great head start.
That's what tartar is. Tartar is like little splinters under your gums. And you know, when you get a splinter in your finger, if you don't touch it, it's not going to hurt. Yeah. If you touch something, it's going to hurt. That's your gums telling you something's going on with it.
On this special day, the students received some professional instruction and advice. They also extended their smiles and blessings beyond Jackson Central Mary.
This year, with our Give Kids a Smile program, which is a national program, this year we included Northside to do some screenings. We were a little curious too, and we'd hear in the community, is this just JCM? It is not. Dr. Christian Culberth and several other volunteers, we all went together over there, and we took a sample group and we did screenings. The problem was just like JCM.
And so 50 specially selected students were given the dental care they so desperately needed.
This day is a big day for me because it's a chance for me to give back something to the community. You know, I've been so blessed and so fortunate to be able to do what I do, and to be able to help these kids that, you know, for no fault of their own, aren't able to have access to good dental health is really meaningful to me.
This day was created by the ADA certainly to provide care for these kids that don't have access to care, but also to increase awareness that, you know, even in our advanced society, there are many kids that go without dental care. They don't have access to care, from transportation issues to mainly economic issues. If that dental is one of those things that kind of gets left out if you have economic difficulties.
To be able to relieve someone's pain, to be able to help them keep a smile that could not otherwise have been able to have a nice smile or been able to gotten relief from pain is worth more than any financial reimbursement. It does. It gives you a good feeling in your heart to know that you're able to help somebody like that.
This dental clinic has made such an impact on me that I joined the oral health team. Obviously, we all have red scrubs on, and I'm now the president. And my job is to teach others and help them, you know, equip them so they can help themselves and help other people.
It is a drop in the ocean, it really is, but it's for the people that we're able to help, it's a big deal, and it's everything to them. And so I just look at it that way.